So this talk today, I'm starting the month of March, and it's all about the self. Okay? There's a lot of things related to self. And the first thing I want to go over that we're going to talk about today is how to examine yourself. We often give that away to the doctors, right? You go there and you just sit there. Okay? Or even if you have an inclination that something is going on with you, well, I've been having a little chest pain, or my hand been hurting, but I need you to know how to examine yourself. Question? Okay. I need you to know how to examine yourself because you own this body vehicle. You know, I always call about the body vehicle. When you get to the mechanic, you have to be able to talk intelligently about your car, right? And the only way you're going to do that is if you know it. And so we got to get away from giving that away to other people. You know, find out what's wrong with me. It's like our sex life. You just make me hug because you know my body better than we're not doing that. I want you all to be empowered to know yourself. So who's going to be my model today? Dee Dee. Dee Dee. Come on down. Dee Dee's going to be my model today. Don't rush up here anytime. Dee Dee. Okay. So the first thing, I'm going to take the chair. All right, Dee Dee gets to be my model. Thank you, Dee Dee. I'm going to stand first. Face first. So first thing I want everyone to do is, how many of you get naked and look in the mirror? I know you get naked for the shower, but I mean like naked and actually look in the mirror. Okay? I need you to do that. I need you to stop being afraid of looking at yourself. I know things change, they drop, they hang low, you know, and everything, but don't be afraid that's you. I want you to look at yourself in the mirror. And when you look at yourself in the mirror, you're going to look in many directions. You want to look face forward in the mirror? Is anything changing? Okay, yeah, all right. I want you to turn to the side in the mirror. Look at your sides, right? And if at all possible, you get your hand mirror and you look at your back, okay? What are we looking at? We're looking at our skin. Yes. We're looking at our skin. And many of us think that because we're melanin, that we got some color in our skin, that we don't have to pay attention to our skin. We do. Of course. Okay, right?
Because I've been noticing that you see the little white spots.
Okay. This is what you're saying. Cocoa butter. So she's showing us that on her skin, she's getting these white spots. Okay?
Old age.
Okay, and some people call it old age. And they say she's not using enough cocoa butter. Okay. But it's important because things happen on your skin that if you don't pay attention, like bruising, you might be on a blood thinner and you might start getting bruising on your skin. Or the weather might change and you get patchy, ashy, right? You start getting it. And then in your neck, right? You might notice you get these rashes on your neck that looks like what we call a spaghetti meatball, tinea versicolor, where dark, light places. You know, many people call it acid. It has nothing to do with acid. It has nothing to do with orange juice. It's actually a fungus. But you look in the mirror and you check it, because sometimes certain places will not get skin changes, right? So that's why you look at the back, because sometimes you sweat a lot in your back and the rash will develop in your back and you won't even notice it. And if you have women or men who have excess large breasts, you got to flip those babies up and take a look under the breast. Fanny rash there.
Fat rolls too.
Yeah, and oh, girl, let me talk about me. She's talking about the fat rolls. All right, so you got to lift those babies up and look under the rolls.
And make sure it's not wet.
And in between your thighs, right? For those of us who rub a lot, sometimes you can develop rashes in the inner thigh because of the friction and the rubbing. So get naked, take a look, flip it up, lift it up, turn it around, look at the back, look at your neck. And if you find a rash or bruise or lesion, like you said, those white spots, then you bring that up to the attention of your doctor. The next thing you're gonna do, besides looking at yourself, I want you to look at how you're standing, all right? So I'm gonna look at her, right? When I'm looking at, are your shoulders level? Okay? Are your shoulders level? Or are they doing something like this? Okay? If you stand in the mirror and your shoulders are not level, that could be an indication that something's going on with the spine.
Yes.
Okay? Called scoliosis. You start hunching over, and then your shoulders start
That's what that told
bending.
me.
And scoliosis is not just a bending, it's also a twisting.
Yes, that's true.
So you're getting this, this, and that will give you unequal shoulders, right? Next thing you want to do is move your arms. Can I move my arms up? Can I move them forward? Can I move them back? Right? What are we doing? Or do I find that when I go to move it, it stays or it gets stiff? What happens in my office? I got people come in and go, it hurts.
Not me,
Oh, okay.
That's the thing I'm feeling.
What's the question we're going to ask? My students, what we're going to ask? What hurts? It just hurts. No. You got to know your body better than that. It hurts when I do this. And in fact, it hurts right here. You can't just walk into a doctor's office and go, it hurts. Okay? You got to give more information, and you get that by knowing your body. It hurts when I go this way, or I go across my body, or I try to reach in my back pocket. And that's important because there are different muscles in the shoulder. You got muscles here, 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 all to help you move that shoulder around. So you have to pay attention as you're standing in the mirror, what can you do with your shoulder? Or are you hearing a lot of noise? Okay? That's the bones rubbing on each other. Okay? Yeah, creaking. Or if you're bending your knees. Yeah. Can I bend my knees? Okay? Can I bend my knees? Yes, question.
With bone touching bone, you have to have that surgery, right?
Depending. It all depends. Question is, if my bones start to rub, shoulders or knees or anywhere, even the hips, does that mean I'm going to have surgery? Depends. I always say, if you can function, what's function? Can you raise your arm? Can you raise your shoulder? Even if it's moving, even if it's rubbing, can I still do what I got to do? You know, what I got to do. If you can still do what you got to do, no. But if you need some, can you reach my bag for me?
Oh.
You know, or can you get the groceries out the car? Or you find that any type of reaching for in the closet for anything causes so much pain that you can't do it. If your life becomes limited, the things you desire to do, you cannot do anymore. It's time to think about surgery. If you've already done physical therapy, you've already got your injections, you've already done your acupuncture, and you're still having the problem, it may be time to investigate surgery. Okay? Yes, question.
If you have like your knees and you're sleeping at night and you get a catch in that knee and you can't straighten it out, you can't move it back, or you can't,
So you lost.
yeah.
Okay. So she's talking about when the knee locks. So you're standing there, it's locking. So she's going to walk up into the doctor's office and she's going to say, students, what question we want to know?
What's wrong with my knee?
No, you're going to say what's wrong with my knee. But yes. Function. The question you want to ask is, when does it lock? Do both knees lock? Right? Are both knees locking, or is it just one knee lock? And if it locks, how long is it going to last lock? Or does it all night, is it stuck in place?
When does it happen?
Okay? And what were you doing when it happened? Were you just laying in bed? You're just asleep and you woke up and it was locked. Now, as an aside to the physical examination that you have to do for yourself, anything that stiffens or locks has to do mostly with your muscles first. Muscles that what we call contract. There's a reason muscles contract. That's what they're supposed to do. But they need certain chemicals to do that. They need their magnesium, they need their potassium, they need their calcium in order to be able to do that. If you get low in those things, magnesium, potassium, and calcium, and water, if you're dehydrated, your joints and your muscles can stiffen. So make sure you're hydrated, make sure you have your potassium, your calcium, and your magnesium. Then run to the doctor and say, it's stuck. Okay? All right, back to exam. I need another person to be my model. Come on. Who wants to be? Come on. Who wants to be a model? I need a model. Come on down. All right, so what else do I have to examine on myself before I get to the doctor? The paper I gave you are the things that, you can have a seat now. Now, she's at the doctor, and before she gets to the doctor, I want her to look at her face, okay? If you notice, she's wearing glasses, right? You have to know whether your glasses work or not.
Right.
Okay? A lot of y'all not paying attention. You put them on, you take them off. You put them on, you take them off. But do they do the job that this, do your glasses work? Okay. And what do I mean by work? If they're meant for you to see far away, can you see far away? If they're meant for you to be able to read the paper that's sitting in front of you, can you read that paper? And read it well. Okay? Not you having to do the movement thing, you know? If that's the case, you got to know that before you get to the doctor. So when you walk up in there and you say, look, doc, you know, I got these glasses last month and they're not doing nothing for me, okay? I think we need to do something about it. Take off your glasses for me. Now, see your beautiful face? When you sit in the mirror, besides putting on your makeup, okay, I want you to pay attention to your eyes. Your eyes are not supposed to be sticking out of your head, okay? When the eyes bulge out, it could be a thyroid condition, okay? Especially if they didn't bulge out a couple months ago. They started really protruding. You want to tell the doctor, you know, I think my eyes are looking a little bigger. Everyone keeps saying I'm looking like a fish lately, you know? And so I think we need to check it. But you got to know that. Doctors only seeing you once a year or twice a year, right? So you have to be looking at yourself and noticing any changes in your eyes. Are they draining? Are your eyes draining a lot? Right? Are they burning? You know, have you ever had that? Okay, so you want to pay attention to that. What about your face? All of a sudden, if you used to have a nice big smile, and you notice it's just sideways, you know, you got the sideways thing going on. You woke up in the morning and all of a sudden, you only got half a smile, but everything else is working. There's a condition called Bell's palsy. Okay, I need you to immediately go to the doctor because we want to make sure there's not a stroke going on, right? Right. But you got to look in the mirror. You got to pay attention. You know, don't just reach for the toothbrush and not take a good look to make sure your face is not changed or altered in any way, right? Like the twisting. Now, next thing, let's smile. See? Beautiful smile, okay? So we not only look at that, let's look at the teeth, okay? A lot of you brush your teeth, but are you paying attention to whether or not they're moving? Your teeth aren't supposed to move. If you're brushing and they're sort of kind of moving a little bit. What happened? Dentures? Well, make sure, yeah. She said her dentures are moving. Well, if they're not dentures, but they're actually the ones that are yours that you started with. If you're going to brush your teeth and all of a sudden you go this way and the tooth goes that way too, okay? Don't ignore that. That could be a problem with your gums, you know? There might be an infection in the gum that's loosening the tooth. There might be a whole lot of disease, but don't just ignore that. And that's your exam. That's not your doctor's exam. Hey, you know, doctor, I was brushing my teeth and the teeth starting to move around a little bit. Okay? Look at your neck. Okay? Your neck has an organ there called the thyroid, right here. Okay? You shouldn't be feeling any nodule. Nothing should be bulging out. You should be able to just move up and down your neck and feel nothing, except maybe a bone or something, right? But you shouldn't feel like a lump in your neck. If you do, again, something to bring the attention of your doctor, right? Okay. Now, as you're sitting, right, and you're looking in the mirror, you look at your eyes, you look at your teeth, you look at your mouth. Guess what area we don't look a lot of? Anybody know?
Your ear.
Your
Tongue. We use it all day long. But do we look at the tongue? The tongue will tell you a lot about your health, right? She said you better brush your tongue. A lot of people don't brush their tongue. If you stick out your tongue and there's this white, thick coat on it, don't come kissing me, all right? Okay, no. You don't want a coating on your tongue. And if you open it, your mouth, and you're brushing your teeth, take a look. Because if all of a sudden you didn't have a coat on your tongue, and now you have a coat, then you may want to investigate what's going on, right? Yellowing of the tongue, white layer coat on it, ulcers on your tongue, like little bulging ulcers. That could be a sign of something going on, right? What if you open your mouth to brush again and you have a lot of mucus in your throat? Now remember, this is new. You want to pay attention to changes in your body, not things that you've had forever. I woke up every day and I always look like this, you know, or I always have this rash here. So I was born with these. Now I'm not talking about the stuff you're born with. I'm talking about new and changes that occur. That's why you have to know your body, okay? Stand up for me. Now, we're not paying attention to her belly, okay? But I want you to touch your bellies. Feel your belly. Touch it. You know, you want to touch it. Don't just take it for granted when you're trying to put on your pants. That's the only time you notice, oh my goodness. No, I want you to touch your belly in all the quadrants. It should be soft, right? It should be like a little cushion, like mine. Unless you're working out a six pack, you know? Right? But you should not feel anything hard like a lump in one area. Now, if you're working on that six pack, you might be nice and hard everywhere, but you should not feel anything called masses or nodules or lump in there, especially none that hurts. Right? Nothing should hurt in your belly. Okay, you can sit again for me. Now, I'm going to take you past the knees because we talked about the knees. I want to go to the feet. The bane of my universe as a doctor. How many of your doctors look at your feet?
Mine did.
I'd say every time you do these. Okay, so about half. I mean, take off your shoes, take off your socks, and look at the bottom of your foot. Look at that bottom. Open up those toes. Okay, right?
All you want to do that is not go get the feet done.
Okay, not the podiatrist. I'm talking about your primary care doctor. Woohoo, she bragging. She did her cocoa butter. You can lift up your foot for me? You want to look at the bottom of your foot. You want to look at the top of your foot. You want to look at the nails on your feet. And you want to open your toes and look between your toes to see if you're developing any kind of fungus or cuts or ulcers or anything, because those are places that you can get infections.
Yes.
And if you're diabetic, it can be dangerous.
Dangerous. That's true.
Yeah, so your feet look beautiful. You have beautiful feet.
That's true.
So don't ignore your feet. Don't just slip them in the shoes and just keep it moving. Oops. She said y'all need to wash your feet. I know, especially before you see your doctor, please. I would appreciate it. I sincerely appreciate you washing. And by the way, you have nails on your feet. And just putting nail polish on it doesn't clean it. Okay? It's just hiding stuff. You gotta literally get up under those nails and clean them out. And if you can't get down there, have someone else do it for you. But getting a regular cleaning the toes, open it up, get under those nail beds before the nail polish. Okay? And for your doctor's sake, if you would, hook a sister up, wash your feet before you come see me. Okay. So we've talked about our spine, our shoulders, our neck, our back. Yes, question?
Yes, one of my daughter's friends, she passed away, a couple of days ago. She been complaining about, she wasn't going to the doctor. She kept saying she had this pain in her leg,
Yes.
but she would never go to the doctor.
Okay.
And she probably like 30 something.
Wow.
She's young. She's my daughter's friend. And she passed away a couple of days ago because when she finally went to the doctor, she had a blood
A
clot.
blood
in
clot.
her.
Oh my
Blood clot.
And she was, she kept saying her leg was hurting for like 2 or 3 weeks, but she would never go to the
Weeks.
doctor.
And that's where that's why we're having this conversation. Because the doctor is the end game. It's not the start of the game. Your doctor is your end game. You're the person who's in charge of this vehicle. Okay? So when it starts acting up, you gotta be the one to notice. Because you've been looking at it on a regular. You've been looking at your eyes, you've been looking at your ears, you've been looking at your hips, you've been making sure everything does what it does every day. You can't depend on your physician to be your source. They're there to help you, but it's yours, your body. That's what I'm telling you. I'm having this conversation because I want you to be empowered to know that you gotta be in charge of your body and awareness. If your leg starts hurting, and it doesn't usually hurt, you didn't play basketball, you didn't go work out, you didn't go on a long trip, and all of a sudden you start getting a pain in your back of your leg, pay attention. Pay attention, especially if it starts getting worse. Progression is a sign that something is wrong.
Yes, absolutely.
Okay? Anytime something progresses, and take yourself to your doctor as soon as you see a change, especially if the change starts to progress.
How long does it take a blood clot to move from your leg to your heart?
It depends
on the
on your
person.
circulation. Depends on the person. Depends on their circulation.
Circulation.
Yes. Okay. Thank you. Yes, ma'am. She's on the spotlight. Thank you. And she used her cocoa butter.
Alright, you know cocoa butter?
Yes, she is.
Sound like a winner.
Questions? Yes.
I got a question about, pain in your hand.
Yes.
Moving up and down.
Okay.
Especially at night or the evening.
Especially
when
at night.
you're carrying something, you drop it.
Okay, so she's mentioned 2 things. She's asked, her question is, what is it when you get pain in your hands? And especially, it could be arthritis, but it could also be other things. In your hand, there's lots of muscles, but there are also nerves and arteries and veins. So the first thing you want to think about, like you said, what have you been doing? If you've been on the computer typing for hours on end that you haven't done in a long time, or playing the piano, or cleaning, or scrubbing, okay, they have muscles. And just like muscles in your back or in your legs, they can become fatigued also. They can become tired. The other thing is, what if you're not doing anything with your hands? Okay? They can atrophy just like your legs and your arms and your back will atrophy. Overuse, underuse. Now, the more serious things that can bother you where you start to drop things is called nerve damage. If you have nerve damage in your hands in a condition often called, most common being carpal tunnel.
Corporal tunnel, that's what they have in mind.
Yeah. There are nerves that run in
here. We have to
here.
take surgery with it. The 2 we have to take surgery.
She ended up having surgery. When you hold up your hand like this, there is a tissue here, a band,
Right
that
here.
holds the arteries, nerves, and veins in place.
Yes.
But sometimes because we do the type of work that compresses this over and over again, it traps the nerve. And it could make it very painful, and it could make you drop
I
things
go
also.
through it.
Lots of pain.
I go through it. I could even take up not in as much as a pillow.
She couldn't even pick anything
I
up.
go through it.
How long before you decided to have surgery?
I have the first surgery me have it last year, same time with Corona.
Yeah.
And
How long did you have the pain before you decided to have the surgery?
Long.
Over a
Because
year?
The last time when me have it was just in November here.
How long did you have it?
A good time.
Over a year?
Until it did all my fingers then.
Okay, hear what she said, right?
My fingers then, I couldn't do this.
Okay, let's not do that,
Mm-mm.
okay?
A long
Because-
She waited until her hands were like this.
Yes, my hands are almost crippled.
She could not use her hands. In answer to your question.
Yeah.
We don't want to get to the point, remember what I said, when do you decide for surgery?
Well, when me go to doctor, he was treating it. He give me injection in it. Come back 2 weeks, come back, he give me injection. It is of no use.
Till her hand was
Till
this.
my hand almost crippled. I couldn't bathe my own self.
Okay, so here we go. We don't want to get to that place. We want to get close, but not to where you are unable to do all the things you like to
I
do.
couldn't even cook myself food.
So if you're dropping things, check out for carpal tunnel, overuse syndrome, weakness of the muscles. You've done exercise, physical therapy, you've gotten your injections and nothing worked, then it's time
No
for surgery.
physical therapy, everything.
Yes.
And it don't work until.
Question.
No.
I get a lot of cramps at night. Lately, I've been getting about a year and a half. Bad. I have to get up and rub my knees, and
Oh, Lord.
I
don't
got
talk about the
problems
knee,
in my
Master.
knee. But I cramp at nighttime.
So back to cramps. Good question. Cramping is a big subject. First thing you want to make sure you stay hydrated. Remember we talked about that. Cramps, sometimes we get Charlie horses cramp in the back of our legs and our knees because we're
Lord have
dehydrated.
mercy, Lord Jesus.
And we'll say, but I drink water all day. Maybe not enough. And everybody's different. Don't gauge yourself by somebody else.
No.
You know, some people can get away with 2 bottles of water.
Mhm.
Other people need 6 bottles of water.
I need a lot.
So if you, water, hydrate. The second thing, back to what I said before, potassium, magnesium, calcium. Make sure your electrolytes are up. A little extra magnesium, by the way, helps sleep and relaxation, but it also helps with cramps. Yes.
You should write it for them.
Okay, so we were talking about cramps. Okay, so we want to make sure we're hydrated. And soda does not count as hydration, nor does juice. Okay?
Could they contribute to the cramping?
Soda and caffeinated products dehydrate. So I always have a rule, 2 for 1. For every cup of coffee, you need 2 glasses of water. For every a can of soda, make sure you have 2 glasses of water. For every can of juice, 2 glasses of water. So you do the 2-to-1 ratio for juice, sodas, and caffeine. Okay? Potassium.
Cause sodas make you thirsty anyway.
Exactly. Potassium, magnesium,
I make my own juice.
and
Blend my
calcium.
own juice and drink. But it's
Now, pay attention to this one. Be careful with this one. If you're already taking potassium because you're on a water pill, okay, you don't want to take any more because potassium could affect your heart rate. Okay? It also can give you diarrhea, by the way.
How many bananas can you eat before?
banana.
Like if I go and eat 3 or 4 bananas and I go to the lab
Banana.
and go to the doctor, he said my potassium is high.
Yes. If you're having 3 and 4 bananas, I'm not surprised because banana gives potassium. Okay? And are you diabetic by chance? If you don't mind sharing? Are you
Not the
diabetic?
bananas.
Okay, good. All
Why do
right.
you eat so many bananas?
He likes them.
You just like the bananas?
Banana nut bread and all of that.
He likes bananas.
Oh,
Okay.
yes, I like bananas.
Okay. Here's some rule of thumb for everything in life.
Everything.
If your body talks back, listen. Okay, if your body starts talking back, listen.
Listen to it.
And it's talking back when your blood levels start changing. So if your blood level is supposed to be, say, 200 for cholesterol, and you start going to the doctor and the levels start going to 250, 260, it's talking back. Right? So you're having potassium, 4 bananas, and your blood levels are going high, talking back, cut back. 50%, drop immediately. Back to 2.
But I can stop. But I eat, I have a muffin I love. Banana nut.
So go back up the bananas again. I already told, what he gonna do? What did I tell him to do? 50%. You're going to 50%. You're cutting back half of what you used to do. If it's a whole muffin, you get half a muffin.
He go to Walmart, when we go to Walmart, you know the 6 trays?
Yes.
Those are my favorite muffins too.
Yes. But your body is saying too much. Too much. Listen.
Yes.
Yes.
Okay.
Look, there's a saying in Jamaica. We're going to drop the patois upon you.
So I'll drop the banana nut.
Him who don't hear, go feel.
What about,
If you can't hear, you go feel.
blueberry muffins? Would that be better?
Well, for potassium, you'll be okay. You know, although blueberries does have potassium
Something
too.
else will
Okay.
come up.
Just pay attention. Listen. So in America, they say, hard is make for what? That's soft behind, right?
Hardest fitness that I saw.
Pay attention. Yes, ma'am.
For these things here, is it better to eat a food or a pill? Because the doctor do put you on pills when they do the blood work and find out that your levels are high.
Okay, so it's a great question. Should I be trying to eat my magnesium, my potassium, and my calcium? Most definitely. Incorporate it into what you already are eating. What I don't want you doing, well, the doctor said I need more magnesium, potassium, let me do additive. I don't want you already eating your meal and then you say, well, I need potassium, let me add 2 more bananas. Okay? I need more calcium, so let me drink 2 more glasses of milk.
No.
Because you're increasing your
Drink
calories.
water.
I want you to exchange. If you know you need more calcium in your diet, and you haven't been taking in anything with calcium like kale and spinach and broccoli, they have calcium, add those to your diet. But don't do an additive thing, like now adding 2 more glasses of milk for the day, because you're increasing your calories. Now, if you already feel like you're eating enough, take a supplement. Take something that's not going to add more calories to you. I take supplements simply because, one, they're quicker and easier for me. I choose a supplement that's easy to digest. Liquids are easier to digest. Things that dissolve are easier to digest. Pills have a tendency to sit in your stomach for a very long time. So when it comes to your vitamins and your minerals, try to get the ones that dissolve faster and quicker. And if you have anything going on with your stomach like reflux, gastritis, ulcers, keep in mind that your stomach is not functioning as if it was not having those conditions. So certain things don't absorb very well. People who've had bariatric surgery do not absorb their vitamins as well because most of the stomach is not being used. Okay?
Can I ask a question?
Last question, yes.
Which one do you, or is it equal? Like the gummy vitamins or the pills? Which one is better?
I like the gummies.
You like the gummies too?
I like the
Yeah.
gummies.
I like the gummies because they taste good. The only problem with me and the gummies is because they taste like candy. You're supposed to have 2 a day, and I'll end up with like 6 for the day because they taste so good. So you gotta be careful with the gummies and digestion and the gum. And if you're a vegan, of course, you won't be eating gummies because they have it's not
Animal.
it's as animal product. But which is better? The most important thing is the content. Look at what's in it. Gummy bears do take a little longer to absorb, but if you know you won't eat it because it doesn't taste good, go for the gummies. And if you don't care about what the pill is, pop it and swallow and keep it moving, then get it, that's not a gummy. If you have a problem with sugar, get the sugar-free ones, because they do have sugar-free gummies.
Sugar-free gummy, vitamin?
Yes,
Yeah.
they have the sugar-free ones.
They got the sugar.
I take the one that says vitamin for men 50 and over.
Yes.
Centrum.
The Centrum. Now, pay attention. We moved into vitamins, which I'm going to do at another talk.
Oh, my
But
bad.
keep in mind, do not duplicate. Many of the multis, those multivitamins, they already have those things in them. Potassium, magnesium, calcium, B's. So don't take a separate B12, B6, B complex.
Okay.
Because I go into some people's houses and they got a cabinet full of all these vitamins, and they have a multivitamin. So make a decision, the singles or the multi. Now, if your doctor tells you that you don't have enough of one, like for instance, my magnesium is usually low, potassium is low, I take it separate because I'm specifically focusing on potassium, I'm specifically focusing on magnesium. But if you don't have any of those conditions, like I had cancer, so nothing seemed to absorb too well in me, so I take supplements of each one. So I hardly ever do a multi because I don't need all the other stuff. Okay? And plus they call it expensive urine. Just take what you need. Okay?
Would you think we should take the multi?
If you need it. If you need it. Eating your food is always better than having to take a supplement, but you take a supplement if you have a deficiency or like you're having cramps, then you may need to take additional things. Okay? And you want more calories also. Watch your calories. All right? Yes.
Okay, I'm trying to make this make sense.
Okay.
So okay, you say sugar-free gummies, the vitamins, right?
Yes.
So they come in multivitamins as well?
Multivitamins, you can get them for almost every vitamin, almost everyone has a gummy.
Like the one.
And I know because my fiance came in the house and he had magnesium gummy, he had the melatonin gummy, he had all the gummies.
All the gummies.
She said, pick what you prefer, a
Yeah.
multi to cover everything, or the individual ones, if you have one specific thing that you're deficient.
Okay, I see.
Yeah, like he said Centrum mix, there's one for women too, that's no mix.
Excuse me, Fred?
Centrum.
Fred?
Centrum.
Yeah, go ahead. Yes, ma'am?
I used to take potassium pills.
Yes.
They seemed to bother my stomach, so he told me to start taking chewing the tongue, or take some coconut water.
Oh, coconut water does have it also. So there are foods, and you'll have to investigate it. We're gonna do nutrition on one of our talk videos, that'll be in April. There are foods that you can have. I always prefer foods, but sometimes some people get full quickly, you know, and they don't want the calories because they're gonna gain weight. So then you go to the supplements. Question?
Taking a vitamin, is it good to take your other medicine with the vitamin?
Good question. Should I take my supplements with my vitamins?
The medication?
And should I take my vitamins with medication? Depends. You have to pay attention and read some medications you cannot take with anything. For instance, thyroid medicine, you cannot take with anything, not vitamins, not food, not any other medications. So pay attention, in the insert, they'll tell you whether you can. There's certain heart medications that you cannot take, grapefruit, because it interferes with it. So you'll have to read up on the medication to make sure you're okay with taking that supplement.